Hi, everyone who's logged in so far. We're going to give it a couple more minutes and then we'll get started with the whole group. Hi, everyone. Thank you for joining us and welcome back. I think we'll be joined by some more people, but we're going to go ahead and get started. I want to honor your time. I will introduce our esteemed panel here shortly. Just a couple of quick housekeeping comments. So we are in a webinar function. There is a question answer feature that is on. Please feel free to put some questions in there or comments, but just know that we're going to answer those questions after the fact, as we're going to not have enough time, I don't think, to do it this evening. Also, if you use the raise your hand feature, we're not going to be able to provide an opportunity for the audience to speak tonight. So I would ask you to put your comment within the chat again, or into the question answer feature, and we will get back to you. So I am very excited to bring you this community forum. We have some of our community partners with us tonight, and I want to thank them in advance for their willingness to help us. We are one community, and we work together to better opportunities for students and our families. So just briefly, I'd like to introduce our panel and we'll get going. We are joined by the Honorable Cynthia Liu and the Honorable Paige Dollinger. Both are judges with the 2nd Judicial District Court. We are joined by Paula Berry, who is a licensed clinical social worker, and she's the mental health counselor supervisor with the Department of Juvenile Services. We are joined by Jessica Gogachia, who is a licensed marriage family therapist, and Jessica is the clinical supervisor for the Washoe County Human Services Agency. We're joined by Nicole Altamirano, who is a licensed marriage and family therapist, and she's the clinical director with the Children's Cabinet. And finally, we are joined by Dr. Kristen Davis Coelho. She is a clinical psychologist and the chief behavioral health officer with Northern Nevada Hopes. As a preface, and we're going to get right into the panel discussion, I just want to share that the large majority of school-age children living in Washoe County attend our schools. Our students are with us between 30 and 40 hours every week, sometimes longer. Some of our students and families rely on meals, breakfast, lunch, and dinner. Because of this, there is so much attention paid to the work of our teachers and our administrators. The work is complex and it's challenging. We know we are instrumental with respect to the health of our broader community. So we want to better understand our connection to some of our community partners and how our community partners are also grappling with trauma and its impacts on students and families. So I'm not going to ask every panelist every question, but actually for a couple questions I will. So I'm going to ask all of our panelists to respond to this first question. And Judge Liu, I'm going to impose on you and ask you to get us going. So among the clients you serve or have served, both youth and families, how frequently is complex trauma a contributing factor? And how does that show up? And how does it affect the family as a whole unit?
Thank you so much, Paul, for having me go first. I appreciate it. I just want to thank the school district and Paul for the gracious invitation. It's an honor to be here tonight. I would completely concur with Paul, or Dr. Lamarca, as I like to call him, as the school is often the most first point of contact for these traumatized families. And because you see them so often, you see them daily, you're really our frontline workers there. And I really appreciate and want to acknowledge how much you have to do aside from just what you do in the classroom. But as we all know, any litigant that comes into the courthouse comes with their lived experiences. And so they come with their complex trauma into the courtroom. They don't leave it at the door just because they enter the courtroom. So we do see that in both parents and children when they do come to the courthouse. As you know, we also handle in the family division the foster care cases. So the foster children that definitely come with complex trauma. You see them in your schools as well. And so it's absolutely an acknowledged factor that we see as part of every case. It tends to show up in their emotions of how they are acting in the courtroom, probably not unlike how they're acting at the school or in their classroom. So we see it everywhere from frustration to anger, to fear, to nervousness, to submission, even at times, because they just don't know how to address everything that's going on in their lives. So we do see it affecting the entire household that comes to court.
Thank you, Judge Liu. Jessica, would you mind giving us a perspective from the Human Services Agency?
Absolutely. Thank you, Dr. Lamarca. So working for Human Services Agency, as Judge Liu said, trauma and complex trauma tend to be rampant in almost every single case that we see. And usually it's not, just one member of the family. Usually we identify and can track complex trauma for generations at times. And oftentimes we see families for generations coming through Washoe County. And so I would say how frequently would be almost 100% that we are seeing complex trauma in the families that are coming in. And that's not just the families that are coming in, because they are having a removal, but also the families that are being referred to us for clinical services, or the families that have adoptive placements that are struggling, or, our foster families as well. So complex trauma is something that we see across the board in all the different entities of human services.
Thank you, Jessica. Dr. Davis Coelho, can you enlighten us from HOPES? You're on mute still.
There you go. Thanks. So those who aren't familiar with Northern Nevada HOPES, we are a community health center that has integrated primary care, behavioral health, and support services. And the rate of poverty in our service area is about 43%. And at any given time, about 25% of the patients we work with are experiencing homelessness. So that sort of gives you a brief picture of the population that we tend to work with, because we're designed to work with people that have challenges affording services in other places. So as you can imagine, complex trauma and intergenerational trauma is very, very common in our population. The piece of how it shows up that I wanted to touch on really quickly is kind of the interactional nature of complex trauma in the family unit. So you often start with a parent that has a complex trauma history of their own, and then you add in a child that has a complex trauma history, either the same one as the parent or a different one. And so the parent is struggling themselves to cope, right? They have probably poor coping strategies, multiple psychosocial stressors going on, lots of complexity, lots of problems coping. And then you add a child who, I don't need to tell anybody in this audience, can be very challenging to manage, even for those of us with really good coping strategies. And so you add the child with this history and behaviors with a parent with that history and behaviors, and it becomes this sort of ridiculously toxic cycle between the two of them, not for either of their faults. If you add other siblings into the mix, another partner, a parent's partner into the mix, and it becomes this revolving cycle of interactions that just recreate the trauma for everybody involved. So the parents poorly, the child acts out more, which then makes the parent feel more powerless and more traumatized, which then makes the parent more poorly, which then makes the child act out more. And it just becomes this revolving kind of familial trauma cycle. And often then the agencies that work with them can get pulled into that, the school, right? The teacher gets pulled into this sense of powerlessness because it just sort of spills out into all of the different helping agencies and people that are working with them. And it's something that's very, very challenging to break for all of the individuals involved, the people in the family and the people trying to help them. So I just wanted to kind of highlight that it isn't this static, a kid with trauma or a parent with trauma. It becomes this really evolving, complex kind of interaction between the family.
Thank you. I think that's been our experience in many instances too. So I'm glad you shared that. Nicole, how about children's cabinet? Is trauma, are you seeing that with students and families, and how is it showing up, and how's it impacting the family unit as a whole?
It's definitely prevalent, probably amongst 80% of the clients that we work with in our family counseling department and at our agency as a whole. Just to piggyback, I couldn't have said it better than Kristen. Kristen was spot on with the cycle and what happens within these families. What we've noticed is it leads to less quality time with the children, which is some of what they need to improve those relationships, the communication within the home. That's a lot of the work that we try to do with the families, is just increase communication, increase quality time, because there's a lot of behaviors, yelling, missing school. Of course, we do the suicide program, so we see a lot of suicidal ideation, and then disconnect once again in the home from the parents, and how the parents can handle that in a better way.
Thank you, Nicole. Paula, I think you primarily are supporting students at Jan Evans Detention Center. So maybe you could comment from that perspective and any additional perspective that you may have.
Okay, thank you. Yes, we see trauma. Almost all of the kids in secure detention have trauma history, and over half of our probationers have complex trauma. And in detention itself can be traumatic for kids for a variety of reasons. And we do see that show up in suicidal and self-harm behaviors, aggressive behaviors, anxiety, depression, post-traumatic stress disorder. So we're dealing with that on a daily basis as we try to safely house kids while they're here. And we do try to provide as much safety and comfort for them as possible. As a department, we also see that intergenerational trauma as families are trying to maneuver the court process, which is quite stressful for them. And we do try to provide supports for families as they do maneuver that court system. I've been doing therapy with kids in secure detention for almost 15 years. And my practice has been primarily focused on the treatment of trauma. And so it's something that we deal with on a daily basis here in detention and in probation.
Thank you, Paula. And Judge Dollinger, we started with Judge Liu, so we'll end this question with you, if you don't mind.
Thank you, Dr. Lamarca, and thanks for having me. I'm honored to participate on this panel. And when I saw Miss Berry, it makes me, we have a lot of kids in common because in recent years, I was the court master assigned to do all of the juvenile delinquency cases in Washoe County. So that's where Miss Berry is at Jan Evans Juvenile Detention Center. And then Judge Liu and I spent a bulk of our respective careers working with kids and families in the child abuse, neglect, or foster care system. And so both case types I'm really passionate about. And I think, and I agree with everyone that's spoken on the panel so far, that we see trauma in a majority of dependency and delinquency cases. With the kiddos, I think it tends to show up, as Paula was just saying, with mental health diagnoses like post-traumatic stress disorder that is chronic. And I noticed when I was at Jan Evans, kids would start using substances at an astoundingly young age to cope with the trauma that they were experiencing. And then also a lot of times their parents have substance addiction issues. So that type of behavior is being modeled, which just increases the cyclical nature of trauma. In the school setting, these kids are then going to school. They have so much on their minds and they're not focusing on everything that they have to do at school. And we hope that most of the time their teachers and counselors know about what's going on in the home environment, but oftentimes they don't unless the child reaches out and tells somebody. And so you might see kids who have behavioral issues in the classroom, poor academics, and are really struggling. And so that's where, I see in a majority of the cases I preside over kids that end up having individualized education plans, which are really helpful. For the family unit as a whole, I think that trauma tends to break families apart because we see kids getting removed from their parents' care and placed into the foster care system, where the goal is to work to reunify the kids and their families, but it affects bonding issues. Oftentimes there's domestic violence that's experienced in the home. And so there's all kinds of legal barriers to reunifying kids with their parents in those circumstances. And again, the kids are seeing parents engaging in violence in the home. And so kids end up having anger management issues. Kids end up with the substance addiction issues. And so it is extremely, it damages their brain from a very young age. And it's so hard to treat. I liken it to somebody that's trying to recover from a traumatic brain injury. When kids are exposed to all of these such significant traumatic events at such a young age, it is very difficult to come out of for them. And so we all have our work cut out for us.
Thank you. Yeah, we indeed do. I think anecdotally, I would say one of the ways it's showing up in the school district is in our chronic absenteeism rates. And I think that's clearly been exacerbated by the pandemic. But I think when families are struggling with, housing security, employment security, food security, sometimes education can become sort of the last stressor, the least important. And unfortunately, it's really critical for our kids in order for them to sort of move forward. So let's move on, given that it is clear trauma is showing up with all the folks that you serve. Nicole, I'm going to pick on you. How has your practice or your agency's practice, the Children's Cabinet, changed as a result of greater awareness of the role trauma plays in disease and behavior?
We've kind of adjusted our therapist schedules to meet the community need to see a clinician when most clinicians are booked at this time. Almost everybody has a wait list, especially if the clients don't have insurance. So we've implemented crisis hours where if somebody is in crisis and they need immediate assistance, or a parent has concerns about the safety of their child and they don't have anybody to talk to, we have walk-in hours Monday through Friday from 12 to 3, where parents can contact me usually to schedule something for them to come in on any given day, just so we can meet with them face to face, because a lot of times they'll call many different places and get the same answer, we're booked, or here's some referrals, call yourself. So we like to meet with them face to face to see if we can connect them with some more consistent care, or at least get them to a stable place, even if they need to come a couple weeks in a row, so we could get them to a good place and so we can have them on our wait list. Our wait list is pretty extensive right now since we don't charge for our services. Another thing we did is we started tracking ACE scores. So we provide the ACE to all of every family member that's attending therapy with us will take the ACE, and we track the parent scores and the child scores of those. And then another thing that we did is we tried to make our family counseling department therapy rooms just a really welcoming environment, age appropriate. We work with young children and adolescents. So depending on, we try to kind of tailor the care to their needs to the best of our ability.
Thank you. Kristen, Dr. Coelho, could you comment about how your practices have changed?
Sure. So we're really fortunate at Hopes to have an integrated medical and behavioral health service. So that lets the pediatricians, the pediatric psychiatrists, and the pediatric therapists all work together on cases. It's been really helpful because I can't tell you the number of times a pediatrician has had a family come to them, with kind of reporting symptoms of ADHD and school problems, and the pediatrician can reach out to the therapist directly just down the hallway, or the pediatric psychiatrist, and go like, what do you think? Is this ADHD? And I can't tell you the number of times the therapist has done an assessment and it's come back and said, this is all trauma. Like, I wish it was, kind of as easy as ADHD and we could just give them a medication. But then they can collaborate on that care and working with the family on whatever is going on with them at the same time. And again, on the other side, recognizing that, the kiddo that presents for therapy that has anxiety and a complex trauma history, high ACEs score, is the kid that they're going to see, that the medical providers are going to see 15, 20 years from now with hypertension and higher rates of cancer and diabetes and all of these medical issues that we know come out of early experiences of trauma. And if we can catch those kids early enough and help them develop some skills, then we might be able to intervene both in their mental health life trajectory and in their physical health life trajectory. So we try and capture it from all angles when possible.
Thank you. Jessica, would you like to add some comments?
Definitely, thank you. So at Human Services, the clinical unit has definitely grown and expanded the more that trauma is, talked about and recognized and studied, and with, the ACEs scores that have been discussed already. And some of the things that the agency has done is ensuring that when we do have to remove a child, that kid gets an assessment within the first 2 weeks that they come into care. So whether that's, somebody in the community that we can link that kiddo to, or one of our therapists at Human Services Agency, those kids get assessments so that we really know what to do and how to connect them. And like Nicole said, there are so many areas and so many places that have wait lists. And so another thing Washoe County is doing is doing interim services, so short-term, brief solution-focused therapy, and being able to do a warm handoff, which is, our ability to kind of build a relationship with kids and families, and then be able to actually physically take them or do phone calls with the new therapist. And so kids and families are a little bit more, feel a little bit more welcomed and supported through that process of therapy. We're also doing a lot of preventative work. And so, we may get calls from any number of the people who are on this screen saying, something doesn't seem right. And, our clinical unit is sometimes able to reach out and ask what's happening and provide some services for the family, for the parent, for the child, depending on what the need is, and help connect them to services without having it turn to something that brings the kid into care. And then also providing a lot of post-adoptive services, clinical services that we didn't necessarily have all the time. And I know that there will be some programs that will be talked about later, but we also have our clinical staff. We just continue to make sure that they're trained in the best evidence-based practices and that they're working with the courts. So we do, we have trained therapists who are doing child-parent psychotherapy, which is working really directly with Safe Babies Court, which is really trying to turn around some of that early trajectory and make it better for the life of these kiddos, so that by the time they are school-aged or adults, that hopefully, things are going in a much more positive way. Our clinicians are all trauma informed and really interested in having the best outcomes and connecting our families wherever is best for them to be connected with services in our community.
Thank you, Jessica. Judge Liu, have the courts changed?
Yes, thank you. Yes, it has changed. By recognizing trauma, we provide trauma training to our court staff and our judges, mainly in the field of domestic violence and addressing those victims, the victims' needs. We refer them to services. We have a great partnership with the Domestic Violence Resource Center for that. As Jessica mentioned, and it was great to hear that Children's Cabinet uses the ACE score. I was really floored by the information I read about the ACE study and how it really can have lifelong effects, not just mentally, but physically. It was quite eye-opening to me. And so when the Safe Babies Court program began, ACE scores had to be part of that, where they had ACE scores both on the parents and the children. We also have had a family treatment court, which was actually the first in the nation in Washoe County, if you can believe it. That was begun by Judge McGee, and we have resources that we provided those parents, which are trauma focused in regards to treatment. And what our court has also recognized, which I'm sure the school district has as well, is vicarious trauma to our own staff. Every time a staff person hears the stories that come into the courthouse and in the courtroom of violent events, see photographs of abuse or neglect, that can cause trauma on that individual seeing that. So we have also recognized the vicarious trauma our staff has. We have weekly therapists available to any staff member who feels that they need that. We've unfortunately had divorce and custody cases that have come through our courthouse that involve murder-suicide. And so when that happens and staff is exposed to that, we want to make sure they're supported, that they're protected from that vicarious trauma. So we've and also been taking into account new practices to even help our own employees, because we recognize not just the trauma of the parties, but the vicarious trauma to our staff. So those are the changes we've made that we hope are improving the system for everyone.
Thank you. And thank you for mentioning that. One of our breakout sessions is, I think Eric Olson is leading that, and it is around secondary trauma. And it's a real thing. And our keynote speaker emphasized the need for self-care and some other remedies. And it is a real issue, and it affects us every day. I also want to thank you again. You may not remember, But when we were sort of collaborating about a year and a half ago, you recommended I read, or everyone read, a book called The Deepest Well by Nadine Burke Harris. I think she's the Attorney General in California now, but I'm not positive about that. But it is a wonderful book, and I'd encourage everyone to take a look at that, The Deepest Well by Nadine Burke Harris. Okay, so we got a bit of a foundation, and now I want to shift just a little bit. I know that we know trauma can influence social emotional health. It can have long-term health impacts. We know that when kids are in a heightened emotional state, it is very difficult for them to learn or really reason to do anything. And so we can kind of at times feel kind of paralyzed. And so somewhat related to that, and Judge Dollinger, I'll ask you to comment first. Does trauma-informed practice result in youth and families being, quote, left off the hook? Does it become an excuse for taking responsibility?
You know, I hate to look at it that way. I don't think it does, because when I think about trauma and what these kids and families have been exposed to in that regard, trauma makes life so much harder to live for them. So I definitely don't feel like it lets them off the hook. I do think that parents sometimes, due to the trauma that they've lived, look at themselves as victims routinely and have a hard time getting out of that role. And so one of the things that we do, and I'll circle back to Safe Babies Court and Family Treatment Court, in those specialized court dockets, and we work closely with the Washoe County Human Services Agency in that regard, is we really try to empower parents and teach them how to live, life in a new way and get them the skills that they need. Also getting the child parent psychotherapy, CPP as we call it, in place, so that from the very beginning of a case, if possible, they're working with that assigned child parent psychotherapist with the child to work on parenting, to work on their relationship with the child. And so I definitely don't think it lets them off the hook. But I do think we educate them as to how to not see themselves as victims and to kind of come out of that. And it's actually, as the judge presiding in a lot of these cases, I'm really proud to see that process take place and to see them learn these skills and realize that they're capable of so many things, and they can go out and get jobs and earn money and provide for their kids and be able to meet their kids' needs educationally and all of these things, and really get involved in their kids' life instead of being so sort of focused on all of the traumatic things that have happened to them in their lives. Another resource, a good outside resource for trauma-informed practice that I know of, in case anyone is interested, is Dr. Joy Asofsky, is a really great resource. So.
Thank you very much. Paula, how about our kids that are ending up in detention? Are they off the hook, or is it an excuse?
This is a very frequent question that all of us in the juvenile justice field get asked. And there are excuses for behaviors and there are reasons for behaviors. And we know that kids with complex trauma have rewired brains and nervous systems. Trauma biologically rewires your brain, and it is embedded in your nervous system and how you react to triggers. That being said, it's really important for kids to understand that that there are limits that are important, that you can't do whatever you want because you're angry or because you're triggered. It's rare However, to hear a child say, I'm doing this because I've been abused, or I'm doing this because I have trauma, more often than not, they're not connecting those dots. They really aren't understanding that some of the underlying factors regarding their behaviors are due to their trauma. And as a juvenile justice system, part of our mission is that we have to create community safety. We also provide services. And when you're talking about trauma, you have to have meaningful interventions, meaningful, compassionate limit setting that addresses the child's trauma in a way that helps them learn to make different choices, to help them rewire their brains, to calm their nervous systems so that they can make better choices. Because we also know that when our brains get triggered because of our trauma, our thinking brain goes offline, which makes it very difficult to make choices that are healthy. They go into fight, flight, freeze, and they're sort of off to the races. So while we provide limits for behaviors and consequences, and it's really important for everyone, trauma or not, to understand that when you have aggressive behaviors like criminogenic behaviors, there are consequences for those behaviors. And as we move them into the future and trying to prevent them from moving up into the adult system, it becomes even more important to really provide those meaningful interventions to address their trauma, so that they can have resolution and then be successful as adults.
Thank you, Paula. Jessica, could you add on to our conversation?
Absolutely. I think that it would be important just to note that prior to going to Human Services Agency, I was the director of a trauma-informed school for young children who had experienced early childhood trauma. And so much of what Judge Dollinger and Paula said just really rings so true, that without a true trauma-informed environment, the expectation that our kids or families will just act the right way in settings in our community is just unrealistic. And so when we see our traumatized kids acting out in school environments or before and after school or in their home environment, I think it's really worth having the conversation of how can the environment support their trauma and the growth and learning of their trauma. Like Paula said, creating meaningful trauma work to be done with those families. And it's not always just the kid, because we can do a lot of great trauma work with our kids, but when they go home to a family that is also traumatized and is living in this homeostasis of trauma and chaos, the expectation that they'll come back to school the next day or to a program the next day and just be okay is really not a wonderful expectation for us as the adults who are trying to create a safe space for them. I found it difficult for some staff members when I was doing this to shift to understanding that being trauma informed means treating everybody every single day like they had a traumatic event happen, because so oftentimes we don't know which kid it is and we don't know which parent it is that something happened last night. And that could be a lot of different things when we're talking about complex trauma. And so, that idea that if I cater to this trauma-informed practice, if I cater to this one kid who has had this trauma, then everybody else, that kid gets off easy, and everybody else, just kind of has to deal with this extra social emotional learning process. I hear that mindset a lot in our community, and I think it's something that is something that I think that we can think about, of how do we just treat everybody like they're going through something really, really hard and create a safe space so that kids are able to hopefully utilize social emotional learning in a way that is beneficial, and can hopefully help them in how they address their trauma, or even just feeling safe enough to go into an environment and not have to worry about every noise, or knowing that if they have big emotions or something is coming up for them, that it's okay that they have that conversation, and that there won't be, it doesn't have to be punitive, or understanding that when a kid does something that is not okay, that you can be trauma informed and still have clear and consistent boundaries. They really should go hand in hand. And so that off the hook part, I think is, something to be really mindful of, how we say that and how we communicate that. Well, our kids shouldn't be just off the hook, but they should definitely be able to understand with really clear context what the boundaries are in all the environments that they exist in the best they can. Because most likely in the home environment, when they're experiencing these kinds of traumas, they don't know what's coming next, and they don't have any of those clear and consistent boundaries.
Thank you so much. And thank you for reinforcing really that distinction between complex trauma and a discrete traumatic event. I've often thought if that's all we had to deal with, as terrible as it is, we could get past that. But it's this consistent lack of predictability, which means on any day that child can be triggered, and we have to be there to support them on that particular day. Again, thank you. So let's shift a little bit, and I'm going to ask you a couple of questions about the school district. I know you've all had extensive work with the school district. Paula, I'll prepare you. I'm going to ask you first. Often agencies rely on the school district to gain access to families and youth. As we talked about, kids are with us for a long period of time. However, the district has limited capacity and many protections it must follow in providing that access. And so I know at times that can feel like a barrier, and that's sometimes in there for good reasons. But can you share a positive or successful experience you have had collaborating with schools?
So Juvenile Services considers the school district one of our most important community partners. And we have weekly meetings with the school district for kids who are transitioning from secure detention or who are returning to the community from out-of-home placements. And we find those meetings to be very, very valuable for the kids, for our agency, and we hope for the school district as well, because sharing that information helps all of us work together to try to get that kid back into their school environment and get back on track. We know that school connectedness is a huge resilient factor for kids who are experiencing complex trauma. And we did an ACEs study here at Juvenile Services in 2015, and it was really nice to see that about 58% of our kids said that they felt connected to their home school. That says a lot about the schools that these kids are going to, and I think that's wonderful. In secure detention, the kids go to school while they're here, and some of the things that I've experienced personally here are that kids have actually graduated from high school while they are here in detention. And even though they can't be at their home school and their families can't come and see their graduation, together with the district, we've been able to get them a cap and gown, get them their diploma, take pictures, and we really, along with the school, try to make a big deal of that, because it is huge for a lot of our kids to graduate from high school. And sometimes they're the first child in their family to graduate from high school. So that's an area also where I feel like we do good collaborative work with the school district, and we really appreciate that collaboration.
Thank you. And having been part of that, I can tell you, we feel that you guys are one of our strongest partners as well. Nicole, could you comment from the perspective of the Children's Cabinet?
Most of our work with the school district has come through the signs of suicide screens that we do in all Washoe County middle schools. And we collaborate well with the school district. One of the things that I really appreciate is at the end of all of our screens, we meet with the school therapist at whatever given school we're at to debrief on students that had high scores or students that had concerns. And so a lot of the times the students will share information with us that the school wasn't aware of. So it gives them the opportunity to learn about it. And they're always really receptive and willing to check on that student moving forward. So at least the student is on their radar.
Thank you, Nicole. Nicole, could I ask you to elaborate just briefly on, you mentioned signs of suicide. Could you elaborate on the percentage of kids that are showing up through that process as a high concern? And if you have any knowledge regarding what some of the primary stressors are.
I'll use today as an example. So today we were at a middle school and we screened, I think, half of 230, so about 115 students. And I would say about 50% of them came up scoring high. And so we score them by green, blue, and yellow. Green is if they answer yes to, are you thinking seriously or have you thought seriously about committing suicide? And, or have you ever in your whole life attempted suicide? So if they answer yes to one of those, they're automatically agreeing. So they see a licensed clinician. And blue is, there's 5 other questions on the questionnaire that pertain to depression or common signs of depression. So if they answer yes to 3 or more of those, they're considered blue. So possible signs of depression. And then if they answer yes to 3 or less, or 2 or less of those questions, then they're yellow. And they still meet with somebody. So everybody meets with a debriefer. A lot of what I saw today was other students, and actually today was pretty interesting. There were other students that they rarely share information about each other, but I think that kind of changed because of COVID and they weren't as connected as they were before. But this is one of the last schools that we're screening this year. So I think they have a little bit more connectedness. So they're sharing that they have concerns about abuse in the home of a friend, substance abuse of a friend, self-harming of a friend. A lot of the stressors from the kids themselves that come up is school. Right now, I think adjusting to school, adjusting to social situations, a lot of concerns about their grades. I feel like 90% of the students that I meet with will report some kind of anxiety. There's a question that we asked, do you have any struggles or concerns that you deal with on a daily basis? That's how I word it. I think it just says that you deal with. I add the last part. But a lot of them will say school. My parents are mad because of my grades, or school's too hard for me, or I don't know how to organize, or my grades are failing. And so it's just this really, really high level of anxiety, and it's consistent. They think about it all the time. I think that, and then just socializing with peers are a couple of the things that I've noticed.
Thank you, Nicole. And I think we all know the pandemic has definitely exacerbated a lot of these problems, but just for our audience, I do think that historically, last several years, our hit rates have been around 33 to 35%. So this is a significant issue on an annual basis. Kristen, could you share from the perspective of HOPES?
Sure. So I'll give a specific example and then a more general one. The specific is that over the course of the pandemic, some of our therapists who work with children and adolescents have been able to work with individual schools to set up teletherapy into the school setting so that the children can continue while they aren't able to come into the clinic or while that wasn't advisable. They were able to continue their weekly therapy doing it at the school site by telehealth. And so that was super helpful for our really high-risk kids to not have a gap in services, and really especially helpful because then you could work with them while they were sort of in the heat of the moment in the school setting where they were having challenges with their peers or with their teachers, or completely stressed out, or really in the middle of having a horribly acting out day, and do the therapy right in that moment. So that was really helpful. My more general example, though, is kind of as my years as a clinician working with kids. When I've been able to work with teachers and school staff to kind of take the long view on progress. So if you're talking about complex trauma, it kind of doesn't matter how skilled the clinician is, how great the agencies are that the kid is connected to, how amazing this teacher is, how supportive the school counselor is. Like, those things kind of don't matter in the sense that it's not going to get fixed quickly, regardless. Like, this is a long-term process to improve from complex trauma. And so I would work with teachers or school counselors who were, halfway through the school year with a kid and super frustrated because they're doing mindfulness in the classroom. They've got the behavior plan in place. They're like doing every supportive thing they can. And the kid is still ending up in the principal's office every other week for the same behavior. And so they're like, it's not working. Like, this isn't working. And then I would have to point out, like, but if you look at last year, that last school year, they were in the principal's office every week. And if you look at the year before that, they were in the principal's office every day. So the fact that they're only in the principal's office every other week this year means it is working. You are doing the right things and we're having progress, but it's so slow. You can't just track it within 1 month or 1 semester or 1 school year. You really have to track it across the long haul. Or a kid who has academic deficits because of trauma. And across the school year, their test scores are consistently staying the same percentage below where they really should be across the school year. And so it seems like they're not getting better academically, but really, if they weren't getting better, they'd be deteriorating, right? The scores would be going down. They'd be getting further and further behind, but instead they're kind of keeping up, not up to grade level, but they're keeping up with where they are. And that is progress. That is a positive. So when you can focus on, like, what is one thing out of this current school year or this current semester, if there's one thing that kid can come out of it with, not hating math quite so much as they did when they started the school year, right? Or not feeling like quite as much of a failure, or just one academic skill. If they could master just this one thing out of, the rest of the kids are mastering 10 things. If they can master this one thing or have one successful experience that they can then hold with them to tie them to the school community as a positive thing, just pick one. And if you can do that, then it is a success and you should pat yourself on the back. So those have been the most successful for me, is when we've been able to kind of collaborate and keep that long view across time for what progress means.
Thank you. I think our behavior analyst would probably give you a big hug right now. So maybe this will probably be our last question. So I'm going to try to give everyone an opportunity to respond. And Judge Dollinger, maybe you could kick us off. What I'd like to ask is, what do you most appreciate about what the schools bring to the clients and families you work with?
Well, first and foremost, I appreciate that the schools are give our kids a safe space to be. But more so, and certainly beyond that, for our kids and their parents, their teachers and principals, school counselors, school support staff, and coaches kind of become, or can become, somewhat of an extended family, and definitely can be positive role models for them, for the kids and the parents both. And their contacts through the school district in that regard become cheerleaders for them, motivate them, and oftentimes become ongoing mentorship figures. Again, for not only the kids, but their parents, who maybe didn't have positive experiences in school themselves when they were young, and are kind of living vicariously through their children this time around. And so making those connections, I think, is something that I really appreciate. And then also the fact that the school can really help guide our families to other resources in the community with other community partners that maybe parents aren't aware of. And so for all of those reasons, I'm so appreciative. And for the collaboration that Paula was talking about earlier, amongst all the stakeholders. I mean, the school district is always a central stakeholder in that regard. And we appreciate working with the school district so much, and the court system as well.
Thank you very much. Kristen, would you offer a comment?
Yeah, I would ditto everything Judge Dollinger said. The partnership is so critical, and I just appreciate I have family members who are teachers, and I appreciate the fact that they go into this with one expertise, right? Teaching is an expertise, and that they inevitably every single day have to become experts at everything else, right? Suddenly they have to become experts at trauma and at mindfulness and at, right, all of these things we're talking about. And for the large part, they do. I mean, they really, they are the boots on the ground in this fight. The rest of us I view as sort of ancillary, right? We each kind of, all of us have our role, and sometimes one role plays a more critical piece than the other, but the teachers, the support staff at school are always the boots on the ground. And I could not do what they do. I will just say that very honestly. I know my limits, and put me in a class of even all kind of non-traumatized, like 30 non-traumatized kids, and I will be traumatized. So I am like, thank you for what you do every day.
Thank you very much. Paula, will you share from your perspective?
Yes. So we know, like we talked about, school connectedness is a very important, and we really appreciate, again, the collaboration that we have. I agree with what has been said, that teachers and schools are expected to just be the experts in everything. And it seems like every year they're expected to learn something new. And, you know, with the pandemic, teachers were expected to just really rethink and change how they teach, whether it's by Zoom or part Zoom and part in class. And, you know, that becomes overwhelming. And we know that because kids are connected, they reoffend less, they get to successfully complete their probation and feel a sense of accomplishment. And I just think that that school connection for our agency is critical in helping our kids to be successful in our agency. And we just really appreciate that so much.
Thank you, Paula. Nicole, can you share from Children's Cabinet?
We are asking about what we appreciate. We're answering the question about what we appreciate about being connected with the schools. I know that I keep going back to the screen, but I think it's because I get feedback firsthand from the students. We have a question on all of the screens about who they would reach out to in a difficult time and what they would do. And oftentimes they will mention a teacher that listened to them, a teacher that was supportive of them. And so they remember that. And just hearing that they have somebody that they're willing to go to, an adult that they trust and that they have a good relationship with, is really, I mean, I can't say more good things about it, because oftentimes we'll also hear that they don't trust a lot of adults in their life. So it's good to know that they have somebody that they see probably, and I'm not trying, for the kids that I do meet with more often than their parents, that they trust and are willing to go to.
Thank you, Nicole. I'm sure all of us, when we think back at our own lives, teachers will be on, you know, the people we count on our two hands that have made huge impressions. And so I really appreciate you sharing that. So Jessica, I do know the cognitive load is really high with all these questions. I mean that because of the kind of the framework. So I'm going to read it again, but I'd like you to respond. What do you most appreciate about what the schools bring to the clients and families you work with?
Thank you. What I appreciate is oftentimes when we start, you know, perhaps when a kiddo does end up coming into foster care and we start reaching out for informal supports, or sometimes we don't reach out. The caseworker or the foster parent will get a phone call from a teacher or a school staff member who says, you know, I'm not privy to knowing what happened or knowing that this kid had gone through, you know, was going through. But now that I know that they're in foster care, I'd really like to maintain a relationship with them and provide, you know, informal supports to this kid. I've had them in my class for multiple years, or they've been at the school for multiple years. I've always wondered maybe that something was going on, but wasn't sure because I recognize that not every teacher knows that about every kid. And I just find that amazing. It always, it doesn't surprise me, but it always amazes me the number of school staff members who reach out to continue being supports for kids when they switch schools, for, if they have to switch schools for a placement change, which, we try to not have happen, but it does happen. Or, when a kid maybe goes from elementary school to middle school. And that's just something that you don't find everywhere. And so we just really appreciate every teacher, every school counselor, nurse, support staff, librarian, every person, they're building a connection with these kids, whether these kids have trauma or not. And when they recognize that something is wrong, they reach out and they want to be able to let that kid know that they're loved and they're cared about in some capacity by somebody else. And I just think that that's just really amazing.
Thank you, Jessica. Judge Liu, we gave you the first word and we're going to give you the last word. You're like a prosecutor. So, could
Which
you
is
comment?
Absolutely, which is interesting because I've never been a prosecutor, but I just really want to echo what every panelist has indicated. I don't think any of us can really express in words. I think the deep connection we all appreciate and feel that the school district has in our community. I think the school district is definitely the backbone of our community. As I said earlier, sometimes you're the first agency that these families interact with. And a lot of the families that come into family court, they come without attorneys, they come, earning $12, $13 an hour jobs. And school has become the most stable place for some of these children in our community, not just the children in foster care, not just the children in juvenile services, but really the children across the board that we see. And so when you think about that and the magnitude of that effect on those children, it's quite impressive and mind-boggling at the same time. So I don't think we can detract on the importance of schools in our community and our school staff and what they do for our children, not just in educating them, but, as Dr. Davis-Polo said, everything else they end up doing right during the day to help these children succeed. So I also want to echo my profound appreciation for all of that effort and all of that work, and it is not going unseen. So never feel like what you're doing is for naught, because so many people in the community see it and recognize it and value it, and thank you for it.
Thank you so much, and thank you, everyone. If education is the backbone of the community, then our teachers and our counselors and our school psychologists, they're the backbone of the education system. Our administrators do tremendous things. For many kids, the first person they see is the bus driver, or they have a relationship with the school site facilitator. I am just amazed by what our folks do in schools, and we appreciate that every day. I'm also very appreciative of all of you and our partnerships, and we are very interested in making those stronger and growing additional partnerships. And I wanted our audience, I wanted our teachers to know that I can only imagine how heavy of a burden it feels like so often, especially when district myself is adding another thing to the plate, trauma-informed practice. But I want them to be aware that there are community partners that are dealing with the same issues, and they support teachers and they support our effort and they appreciate our efforts. And I think together, we can do a lot for our kids, for our families, for our community as a whole. So once again, thank you all so much for your willingness to participate. For our audience members, there were some very good comments in the questions and comments in the question answer feature, and we promise you we will get you answers to those. A couple of them were directed at specific speakers, so we will make sure we get those questions to them. And again, thank you so much for being here. For the audience, we'll see you guys tomorrow afternoon. And again, we know tomorrow will be a stressful day, but give yourself the gift of presence tomorrow and join us, and we'll move forward together. So thank you guys.
Thank you.
Bye-bye.
Bye.